Hello friends, I am Dr. Rajiv Kumar Chatterjee, a practicing homeopathic physician. I am giving a lecture on a very interesting subject, that is, we are very much confused as a common people when to select allopathy, homeopathy, Ayurveda or any other system of medicine. The general public at large is very much confused. Without any prejudice to all or any of the systems of medicines prevalent in the society, the common welfare of the human life is respected at large, and with due regards to all my fellow physicians and friends, I am just trying to give my humble knowledge, and I beg your pardon and to rectify me if I made any mistakes. First of all, we want to know what is a disease, what is health, and what are the systems of medicines prevalent. So, we must start first with the initial basic definition of a disease. A disease is an inimical morphic force that invades dynamically and disturbs the relation between a material body and the vital force that stimulates the body in health. Just as in common man's illustrations, we can say that when our territory is invaded, that means when the line of control is encroached by the enemy of a neighboring country, so the disease also invades the vital force of our body. Various interpretations of the classifications of the diseases may be given and was given from time to time by various authors. The most common which is prevalent is that number one, it may be classified as topographic, two, anatomic, three, physiological, pathological, etiologic, juristic, by the speed of the advent of death, epidemiological, statistical. According to Dr. Samuel Hahnemann, who is the master of homeopathy, he classified as number one the indisposition, which is a slight alteration in the state of health, one or by any trivial symptoms. This slight alteration may be in the diet and regimen, and which may be corrected easily by correcting the causative factors. Two surgical diseases in aphorism 13 and 29 of the Organon of Medicine, which was written and published by our master Samuel Hahnemann. He made it clear that the surgical diseases do not come under the scope of homeopathy, as they are not dynamic or miasmatic in origin. They have to be treated by mechanical or surgical means. Dynamic diseases can be classified into two types. Number one, acute diseases, and number two, chronic diseases. The acute diseases, you can, as it is mentioned in aphorism 72 and 73, where the onset of that disease is sudden, the course is virulent and is short in its span, and its end is fatal or recovery with or without treatment. Whereas the chronic diseases have a slow onset and it is slow and insidious, and the course is also slow and remains till the full lifespan of the patient unless and until treated by any pathies. Acute diseases may be further classified as individual diseases that attacks humans individually due to some exciting cause, mental or physical. Overeating, prolonged empty stomach, heat, chill, wetting, etc. may be the illustrations of acute diseases. There may be mental excitements and it may lead to hypertension, fever, etc. These exciting causes affecting the different people at different places suffering from individual diseases at different or at the same time. Sporadic diseases means meteoric or telluric influence where only a few people are affected who are susceptible to the sufferings from the same cause. Number 3 is epidemic in nature, where a large part of the population is affected, generally become infectious and contagious when it prevails among the thickly congregated masses or human beings. So, these are the classifications according to homeopathy, broadly the acute and the chronic ones, and it may also be said the acute diseases are caused by acute miasms which recur or may recur from time to time in the same manner or may be caused once in a lifetime, supposed, that is chickenpox, smallpox, whooping cough, etc. Generally, they are non-recurrent in nature, but in some cases they are found to be recurring in an individual again and again. Again, it may be classified as an endemic disease where diseases are regularly occurring within an area or community. And also the pandemic. Pandemic is an epidemic in nature, but it is an infectious disease spreading over a large region which may cover multiple continents worldwide. The very classic example is the COVID-19 pandemic, which has affected and taken lives of many in recent years. Chronic diseases are further classified by Dr. Samuel Hahnemann as psoric, psychotic, syphilitic. In a brief, the psoric patient may be identified as a struggling one, the psychotic patients having weakness and concealing habit, and the syphilitic are generally destructive in nature. Further, we may illustrate a little. A psoric miasm, he must struggle to recover or maintain his position or succeed. And the psychotic miasm, a feeling of the fixed, irreversible weakness within himself as he tries to heal from the other. and the syphilitic miasms filling up with the complete hopelessness and despair with response of drastic do or die attempt to change himself or his environment. These are the classifications of the diseases which may help us to identify what to do or have a guideline about the diseases in order to evaluate the treatment of such diseases further by various pathies. Now let us know in medical words the meaning of the word health. The World Health Organization defines health a state of complete physical, mental and social well-being, and not merely by the absence of the disease or infirmity. Health in homeopathy, it means, which is a 200-year-old form of ordinary medicine that claims to stimulate healing response and strengthens the body's ability to heal itself. Different systems of medicines worldwide, allopathy, homeopathy, acupuncture, Ayurveda, traditional Chinese medicine, indigenous traditional medicine, herbal medicine, naturopathy, chiropractic, osteopathy, etc. The most common system of medicines in vogue are allopathy, homeopathy and Ayurveda are some of them which are found to be in practice largely among the common people in India. Allopathy, where the word comes from the word allos meaning opposite and pathos meaning suffering. The term allopathy was coined in 1810 by Samuel Hahnemann to designate the usual practice of medicine allopathy as opposed to homeopathy. It is based on the principle of opposites cure opposites, known in late as contraria contraris curantur and nowadays called allopathy, dominated the Hippocratic therapeutical thinking. That is, a patient of diarrhea is given a medicine to produce constipation. But in homeopathy, it is based on the principle of similia similibus curantur. Literally, it means that all diseases should be treated by similar drug diseases. That is, a patient of diarrhea is given a medicine that will produce diarrhea, but since the medicine is artificial force and of greater than the disease force, it dominates and eliminates the disease and extinguishes itself. Thirdly, Ayurveda is a system. It is a system of medicine. It is a traditional medicine native to India which uses a range of treatments including Panchakarma, 5-action, yoga, massage and herbal medicine to encourage health and well-being. So the scope and effectivity of different systems of medicines should be identified and segregated to achieve the maximum health benefits. Allopathy for acute emergencies and surgical diseases, mainly and mostly palliative mode of treatment. Ayurveda as an alternative traditional Indian medicine in certain ailments, but homeopathy when the disease is chronic and in many cases after abuse of medicines of all other pathies for permanent annihilation of the disease. I think, dear friends, today we have made a specific and a clear idea about the disease, health, and the different systems of medicines, and what system of medicines we should follow and under what situations. Thank you, friends. I will further give you some other illustrations in my further lectures. Thank you.